Defibrillator types, uses and purpose. People who have the above arrhythmias can get help in a hospital or a place that has an automated external defibrillator available. A defibrillator is a device that provides an electric shock to your heart to allow it to get out of a potentially fatal abnormal heart rhythm, or arrhythmia, ventricular tachycardia, with no pulse, or ventricular fibrillation, and back to a normal rhythm. However, if you have a high risk of a life-threatening heart rhythm, you may need your own defibrillator that's with you all the time. Defibrillators for personal use. A shock from a personal defibrillator can be painless or feel as if someone kicked you in the chest. People who are at high risk for a life-threatening heart rhythm may have these defibrillator types: a wearable Cardioverter defibrillator you wear like a vest under your clothes. The sensors make contact with your skin, and the device can send a shock after sensing an abnormal rhythm. Like an internal watchdog for arrhythmias, an ICD can send the right amount of charge when it's needed. While cardiopulmonary resuscitation (CPR) provides temporary assistance, a defibrillator can help you survive sudden cardiac arrest. You can even use a defibrillator if someone already has a pacemaker or implantable Cardioverter defibrillator (ICD). If you're using an automated external defibrillator (AED), it can review your heart's rhythm to decide if it needs a shock. An AED charges itself and provides verbal instructions on how to use it. A first responder or healthcare provider will do the following: put 2 defibrillator paddles or sticky pads, connected to the defibrillator, on your chest. However, your provider will need to put conducting material on your chest before using paddles. For sticky pads, push a button on the machine to give the shock. A defibrillator makes your heart muscles stop moving briefly so your heart can create an electrical impulse that starts a normal rhythm. Your first responder or provider will give CPR again for 2 minutes. Then they'll check for a pulse and look at whether your heart rhythm is back to normal. If you need it, they'll give you more CPR and another electrical shock. If defibrillation didn't work the first time, they'll also give you medications, epinephrine or amiodarone, to try and correct the abnormal rhythm. A defibrillator can save your life if it's used for the correct arrhythmia and it's done within 10 minutes after the abnormal rhythm starts. If you use it for any other kind of arrhythmia, it could give someone ventricular fibrillation and cardiac arrest.